And our next guest joins me here in a moment as we do some chair switching is Dr. Stan Wasbin. We call Dr. Stan the house call doctor because he really does make house calls. Dr. Stan, good to see you again.
Good to see you, Don.
You know, Doctor, not very long ago, about 4 or 5 weeks ago, you and I were in a discussion about something that was in the news virtually every single day. And of course, we're talking about swine flu. And we were thinking back then that the whole epidemic of swine flu and all the news that was being generated was kind of being blown out of proportion. That was the general consensus that we had. But this week we find out the World Health Organization has issued a pandemic alert on the swine flu virus, and this is the first time they've done so on a flu virus in about 40 years. All of a sudden, this has taken on a whole different face.
Yeah, I think the best way to look at it is to touch on some of the important developments here. The virus has continued to spread. You know, now all 50 states and more than 70 countries have reported cases of swine flu. Now, secondly, for the first time, we have a H1N1, the swine flu associated death, the first death outside of the Americas. This happened in Scotland to someone who was previously unwell. But let's put it in perspective. This one death is against a backdrop of more than 1,200 cases in the United Kingdom. Compare it to the United States. We've had close to 18,000 reported cases and only 45 deaths. By flu standards, this still is considered a very mild disease.
Well, now, I mean, people die of the flu virtually every day, just regular good old influenza, not supposedly swine flu. I mean, this is something that happens on a daily basis, correct?
That's right. And when we look at the World Health Organization elevating this threat to its highest level, level 6, what it reflects is the great spread of the disease, not the severity of the disease.
Okay.
One thing we can look at right now in the southern hemisphere, flu season is just underway. So what happens there over the next several months is going to inform us in the northern hemisphere what we can expect towards the end of this year when our flu season hits.
Now, when the World Health Organization uses sentences and terms, and one thing that really struck me is they said there's no stopping it, referring again to the swine flu virus, and they're talking about something like 30,000 cases worldwide that when you consider the global population is really nothing but a needle in a haystack. But nonetheless, when you hear something like there's no stopping it, that has to create concern amongst the general public. I mean, people get scared when their World Health Organization says we have no way of stopping this.
It's a little bit of hyperbole because, of course, every disease, every infectious disease is going to burn itself out sooner or later anyway. But I think what they're conveying is that there's ongoing rampant spread in certain communities. And as I say, there's swine flu right now in more than 70 countries worldwide. So it is spreading, and we do not have a way to really restrict it right now.
Well, let's talk about you personally. I mean, you have a practice in South Orange County. I know that you also spend some time working in emergency rooms. Have you encountered patients that have come to you thinking they have swine flu, or have you actually encountered the virus?
The phones are ringing off the hook, for sure. I've encountered patients with flu, but not with swine flu as of yet. But, you know, testing is available, and you know, we have no problem in determining if someone does have swine flu. Although, as I say, it is a mild illness right now. I mean, things may change, but it remains a mild disease. So people who have the condition, often they should just stay home untreated. What the experts are telling us is we have to focus on treating hospitalized patients with the illness, pregnant women, those at the extreme ends of ages, and people who have underlying medical problems. They're the ones who are at most risk of death and serious complications from the swine flu.
You know, I remember when this thing was really in the news just a few short weeks ago, and on a Sunday I was in church, and at the beginning, before the Mass started, the priest actually got up and said, okay, now there's certain parts of the Mass where we sometimes hold hands during this prayer, or we shake hands or greet one another. We're not going to do that anymore, at least for the time being. I mean, that was then. We don't really see that happening now, but yet now we're looking at this World Health Organization elevation of severity. You have to think that, are there certain things that we can do to protect ourselves?
Yes. The travel restrictions have been lifted. There's no recommendation against travel to Mexico, for example, where it started. But what we can do still remains the simple things. Avoiding contact with people who are ill, continuing good hand washing, avoiding touching your nose, your eyes, your mouth, portals of entry for the flu virus, and staying informed. It's early in this epidemic, and we don't know exactly what's going to happen yet.
Okay, once again, Dr. Stan Wasbund. We call him the House Call Doctor because that's what he does. And for more information, you can visit his website at schousecalls.com. Dr. Stan, thanks so much.
My pleasure.